Hey guys, we're back again for our episode of Leaders at the Table. I'm Cornelius Bankston, your host. Have some incredible guests with us today. We'll kick it off with Dr. Ayo. We haven't seen you here before, ma'am. Welcome in.
I am Dr. Gathing. I am a child, adolescent, and adult psychiatrist by background and training, but I'm also a healthcare executive with a focus on innovation, behavioral health, and person-centered care. So excited to be here with you all.
Thank you for joining us. Melissa.
I'm Melissa Reilly. I like to say right now I'm a former payer executive. A lot of times on panels, I end up being the token payer, but with Dr. Ayo, I don't know that I'm the only token payer on this call. I have recently started my own healthcare consulting company where I do advising for many early stage innovative founders. And this is after working for 25 years in the healthcare space across 3 different payers, oftentimes in the product, go-to-market, and strategy role. And I recently left Cigna Healthcare, where I led mental health strategy and growth. And kind of through that experience, I actually had the pleasure of meeting Dr. Ayo before.
Dr. Sheena, you're back.
I'm back. As you know, everyone, I'm Dr. Sheena Menezes. I'm the co-founder and CEO of Simple Health Kit, passionate about access to healthcare. How do we close gaps in care? Don't leave people hanging. And part of that, what I'm excited to have with Dr. Ayo and Melissa, is there's an element of behavior. Like, how do you engage different communities? And then this behavioral health is a big component of that.
Our topic for this conversation is member engagement and chronic disease management. Dr. Ayo, could you help us to understand what are chronic diseases?
So we like to think of chronic diseases as ones that will persist despite treatment or intervention past a year, or those that require ongoing evaluation and management. So there's not kind of a one-stop shop for treatment or short-term treatment. So those that you're pretty much gonna have a long-term or lifelong kind of management and evaluation and reassessment and ongoing treatment of across your lifespan.
Dr. Sheena, I know that with Simple Health Kit, you have some products and some programs that you offer around chronic disease management. Could you give us some understanding of some of those programs that you all are offering?
Simple Health Kit, we've built a comprehensive gap closure solution, and that's really targeted to be holistic. What that means is, how do you engage a member across diabetes, kidney health, colon cancer? But the idea is that how do we get access to that member, whether it's at home, in a provider-based setting, or maybe even at a retail pharmacy? How do you get them access to an actual test? And make sure we engage that member, and if they're sick, connect them back to care so they're ready to close that gap completely end to end.
What about that behavioral health piece of it all, like the member engagement? How do I cope with whatever results that I'm getting?
What a great question. I'm going to actually start with some of our hardest to engage members, right? So I'll turn back to my time as a Medicaid compliance manager. There, what we were really trying to do so much of was eliminate any barriers that would stop a member from getting the care that they need. So we would do things, just as an example, like bring the diapers to the members at community health fairs, where we might also use a testing or a member engagement kit strategy like Dr. Sheena talked about, right? Because sitting kind of in our perspective, we might have a whole list of members with gaps in care or needs, but it's not like they were picking up the phone wanting to call us over at the payers. So we needed to get out into the community, be where members are. We don't always have time in our busy days to run into a provider's office. So when we can find ways to bring the diapers or a test kit, a diabetes kit directly to the member, that is just a win.
And to piggyback off that, so when you're thinking about chronic disease and chronic disease management in terms of a behavioral health lens, you're also not, really aware of that behavioral health conditions can in themselves be a chronic condition. And then there's a population that has what we call comorbid chronic diseases. So mental health and physical health chronic diseases. You really have to look at, as to Melissa's point, Waking up in the morning, getting out of bed could be a challenge. Going to a pharmacy, picking up their medication could be a challenge. And just really doing those lifestyle day-to-day behaviors is already difficult for some of these members, especially in our Medicaid population, who then has those social determinants of health challenges. So you're really, when you're designing programs and looking at solutions like Simple Health Kit, really thinking comprehensively of how can we make it easier for this person in their life to engage the healthcare system, all of these gaps we want them to close.
You know, I started this off that it's National Medicaid Awareness Month. And so, Melissa, you had just highlighted some challenges that exist within that population here in our country around access. What else do we need to know in order to develop programs and tools to meet people where they are?
We talk about people sometimes from a payer lens as like the Medicaid members or the diabetic members, right? I think one of the pieces that we often forget is that when you're in that situation, you know, I was a single mom once, many moons ago, right? I never thought of myself as that single mom, even though others would classify me as such. Similar with the Medicaid population, they're out there just thinking of themselves as people. One of the tactics that I've used, I think quite successfully throughout my career, is just really trying to understand and walk the journey of a member. I think Dr. Ao was alluding to it as well. What happens when you're working 2 jobs and you don't have time for an appointment? When you have food insecurity or don't know where your next meal is coming from or have to wait for your paycheck to be able to buy food for your family, how do you really map all of those barriers and then systemically find ways to reduce those barriers? I know we all face a lot of pressures right now, you know, as payers, as we try to innovate. It's really challenging. But if you don't, you're not going to see that successful engagement that you want.
We can remove the idea that there is a Medicaid member, because most people in our country, sadly, are 1 or 2 paychecks away from being in a bad situation. So I think we need to understand people from a holistic, integrated, whole person idea, and really, like Melissa said, look at each individual in their situation, figure out how can I make it easier for you to engage not only just our healthcare system, but have a total quality of life. Because, you know, a lot of people rely on their support system. I know I do. I have a lot of good family members so that I can do the things I do. And sometimes our Medicaid members don't. And that's what makes them kind of unfortunate in certain situations. So I really like to look at some of our programming and our pilots we do as how can we be care extenders, right? If you make someone's life better, take them out of survival mode, out of that idea of really, I'm just trying to make it, then they can do things like think about how their healthcare looks or what their other needs are.
Care extending programs.
Yeah.
What do you mean about that exactly? Because that's a new term I've heard in the context of this kind of conversation.
Yeah, so as a payer, in a perfect world, everyone's going to their doctor, right? Once a year at the very least, right? But if you have a chronic condition, you're going way more than that. Yeah. So as a care extender, as a payer, we're saying, okay, your doctor's office doesn't have all the tools and resources they need to wrap around you, get you there, get you your best health. So we are going to be a gap and a bridge to your provider in that care. We're not doing your treatment, but we're gonna help as a care person on your team to say, what can we do to make it easier to engage your doctor, engage your nurse, engage your therapist, engage someone teaching you about your mental health.
Dr. Sheena, I know that you have an A1C test at Simple Health Kit. That's just kind of how you've been able to effectively deploy that product. Any additional thoughts that you have around it?
Yeah, I think it's a great point. Care extension, right? Like, how do we, and that's really where we fit in. Like there is not enough resources or not enough providers, not enough physical brick and mortar places. We come as a solution, a comprehensive solution to a partner and say, hey, we'll deploy, we'll engage. In the world of the, you know, on the business lens, right? How do we reduce the costs of care, but they still improve clinical outcomes?
That's some math that's not mathing right. So how do you think through that?
And so that's the power of innovation and digital health, right? Like, so that's where really where we can extend, we can engage a lot more members. Yes. We can reach, deploy programs across the ecosystem, different states, different zip codes, different languages, different communities, and really get them to the table.
As payers, we are still evaluated and assessed on how well our members are engaging and the outcomes of the healthcare system. So we have to be super creative when we're doing more with less to say, hey, even though I'm not even the one doing the treatment, how can we think differently to get to a best outcome?
I think an area that there's a total opportunity, and I love how Simple Health Kit is really kind of filling the gap around just health literacy in general, right? So I think payers have not done a great job on health literacy. Not because they don't necessarily want to, but I think sometimes the regulatory landscape that payers live in actually shapes in a negative way the way that we can communicate. And here's a great example. Some of the things out on TikTok right now are fundamentally bad, but historically, you haven't seen payers put clinically evidence-based material or content on TikTok or on bite-sized formats, right? And so there was a massive disconnect around how payers communicated with their target audience and the trust that payers have with the target audience. And that's why we need partners like a Simple Health Kit who actually have the communication down, communicate in really easy pictures that explain how to leverage the material sets and really resonate with the members in a different way. Dr. Ayo has a great podcast she does personally. If you haven't listened to it, it's phenomenal, but really excited for innovators like on this panel that know how to communicate and, are really advancing health literacy.
There are populations within our country, within our world that need access to innovative solutions. And not only is it good work to get them the resources that they need, but it's also profitable. And so that's kind of what I'm threading between all the things that we're saying from a clinical side, from a business side. And that's what Simple Health Kit, I believe, is being the glue to all of this is we can develop solutions that can reach these hard to reach populations.
I think we also need to rethink the word innovative, like what we think of when we hear that word, because like what Dr. Sheena is saying and what, Melissa brought up on my podcast, how I eventually got to do it. It's called God Meets Therapy. And it was super confusing in people's mind. Like, how can you talk about God and therapy together, right? How is that innovative? God is something old as time, right? And therapy has been around, but put the words together, boom, innovation, right? And when we talk about things on the podcast, we talk about things like depression in relatable terms. We talk about things like your support system using the word friends or family, so I think sometimes what we think of as innovative, to Dr. Sheena's point, is just because we haven't been doing it. And to Melissa's point, regulations or compliance or other things haven't been tested or pushed or advocated for to say, hey, look, we need to be on TikTok. We need to be on Facebook. We need to be where the people are, right?
Ladies, we got to end sometime. So in closing, y'all have any closing remarks?
As a cancer survivor, and don't worry everyone, I'm well, right? My ongoing advocacy is please take care of yourself and each other. We don't make up the word care gap because we want to subject people to a bunch of tests that are unnecessary, right? Your preventative screenings are there really to make sure that you are healthy and happy and know your numbers. What is that? It's the pinch of prevention is worth, a pound of the cure. I probably have that completely wrong, but
that was lovely, Melissa. And just like you, double down on prevention. There's one thing to manage chronic, but if we could kind of move, up the source, getting these programs, we can actually make a difference in individuals' life, like early detection. It warms my heart. I love waking up day in and day out doing this, working with great partners who taking a human-centered design approach at Simple Health Kit. Thank you all for joining us. I hope we use this platform to create awareness, share with a loved one, share with a colleague of how we can come to the table.
For me, I think we need to Melissa's point, taking care of yourself, and prevention also includes your mental health and your well-being and increasing your wellness, because the more well you are, the more healthy you are to prevent chronic disease, mental health disorders, really understanding that prevention is also your emotional health. So please listen to the signs, be reflective, self-aware, look inward and take care of yourself so that you can be a light to the rest of the world and be here to be living and taking care of yourself.
Well, awesome. Thank you for those parting words. With that, we'll see you on the next time at Leaders at the Table.